Hi, Glenn. How are you?
I'm great. How are you?
I'm fine too. Thank you. Let's begin the interview. So first of all, welcome to Love Heals Cancer and ZenOnco.io. I am Arohi from ZenOnco. This is our cancer healing journey talk where we invite speakers who have been through cancer, either as caregivers or as patients or as survivors. These cancer healing journey talks are very close to our heart because a lot of people have come and told us that these talks have helped boost their confidence and it has given them hope since they see that if other people have beaten cancer, so can they. So with this, I thank you very much for being a part of today's cancer healing journey talk. We can begin with a brief introduction about you first.
Yeah, sure. My name is Glenn Holland. I live in the United States, in the state of North Carolina. I am going to be 52 years old in July. And in February of 2018, I coughed up blood. And that was the first indication that I had cancer. So it was the start of a journey that is still going on now, 4 years later. It never leaves you. It's always in the back of your head. But I truly believe in sharing stories, as you've mentioned, for a piece of others to be able to understand that they are not alone and that there are many, many people around the world that have this type of disease and are working through it. So thank you for having me on. I really appreciate it.
Thank you very much for being here. So what were the initial symptoms that you felt?
Yeah, great question. So at that time, I was working for a large agricultural manufacturer, and I was traveling around the world quite often. And about 2 months prior to me coughing up that piece of blood, I was in Japan on a business trip, and there was one of the mornings I had woken up, I had a heart murmur or a heart flutter that occurred when I woke up, and that had never happened to me before. And this was the day that we were supposed to be leaving back for the United States. So I went to a Japanese doctor who gave me some over-the-counter heart palpitation medicine to try and calm that down. And I took that medicine and didn't really think anything of it. Got back to the United States, and at that point, I went to see a heart specialist where they fitted me with a heart monitor, where they monitored my heartbeat over the course of about 6 weeks. And that episode never happened again. I never had another one. But then the next kind of, I'll call it an indicator, the next indicator that there was something wrong was I went to Ireland, another trip that I went, but this was for personal use. And I felt very fatigued. I felt very tired. We went to a wedding, and I'm usually a person that goes out and dances during weddings. And at this particular wedding, I just felt very fatigued and very tired, and I was not able to physically move and physically dance the way that I had in the past. And I attributed this to being the winter time and being a tobacco smoker for many years. I had quit by that time, but for many years I'd been a tobacco smoker. So every year in the winter time, I would have a cold or a mucus kind of problem, and I attributed this to that annual event of having a sinus kind of problem happen. And so after that Ireland trip, I took one more business trip to Wisconsin, and again, felt very fatigued and very just tired overall. And again, I put it down to being a normal annual sickness that I continually kind of had. Didn't go see a doctor about it, and again, the real indicator was I was having coughing problems with a lot of green sputum coming up from my chest. And then, yes, on February 28th, I had a very severe coughing episode in the morning before going to work, and coughed up about a 3 or 4 inch piece of bloody spit. Luckily for me, I looked at it in the garbage can before I shut the garbage can and saw that that was bloody. So I was able to get it from the garbage, made an appointment with my doctor. My doctor was off on vacation, so I had to see a nurse practitioner who I could tell after seeing her that she knew something was not right. And she sent me to get an x-ray. And from that x-ray, it was ascertained that there was something inside of the lower right lobe of my lung. And it was about 2.5 centimeters, which is about the size of a golf ball, we'll say. There was something in there. And from that initial consultation, I saw an oncologist who initially asked me to wait 6 months or 6 weeks because she thought it was a virus. And me being in North Carolina, where there's a lot of hospital systems, I did not leave it at that. I went to go see another opinion, and I actually went through four different oncologists until I finally got somebody to do a proper biopsy on this mass that was in my lung. And one quick thing about biopsies, you know, once you've heard that those three words that nobody wants to hear, you know, once you hear those words, you have cancer, it sends you down just a rabbit hole of internet. And there's just so many different directions that it can take you. And one of them that it actually took me was that biopsies are potentially bad in the sense that if there is a needle aspiration biopsy or a surgical biopsy, there is the potential that you could dislodge components of your cancer that could then be spread around the body. So I was very skeptical about getting the biopsy, but I needed to have that done. And so after the biopsy, it was turned out that I had stage 3A non-small cell lung cancer, adenocarcinoma, with a 98% PD-L1 trait to it. So that is a fairly common type of lung cancer. Yes, I was a smoker. Yes, I was around fumes quite often in my job. So who knows where it could have came from. But at that point, stage 3A is you have to move, like you have to go and you have to do something. So I was lucky enough to get in. I was lucky enough to contact a friend of mine whose brother worked for the Duke Healthcare Center in Durham, North Carolina. And they were able to get me in to see an oncologist who then assessed my condition and said, we want you to be a part of a clinical trial for Keytruda immunotherapy as a first-line defense. Now, Keytruda had already been out there as a second-line defense, like after chemo, after surgery, after all this stuff. But this was a first-line trial that they took one look at me and said, "You are a perfect candidate for this." So, for the simple fact that I was allowed to be put into this clinical trial, that then changed my mindset into, okay, this is not all about me. I can now help other people. I can now be a part of something much bigger. And so I was all in. Where do I sign? Where do I sign up, right? So signed up for the clinical trial. They gave me Keytruda for 2 doses before surgery. Then they went into surgery, cut out the bottom part of my lung. The cancer had died from the Keytruda, which again, without me being a participant in that, it may not have shown that this is a viable option for people. So I felt compelled to share this story that I was unfolding on LinkedIn. So I did that. Every day I put a 2-minute video out of what was going on. And then so had surgery, still had chemotherapy afterwards. And so now it's been 4 years, and I go back once a year for a scan, and I'm clean, and I've never felt better. I've never felt more alive. And it just, excuse my language, it sucks that it took something like this to change my mentality from what it was before cancer, which was 99% me, 1% everybody else. Now it's 51% me and 49% everybody else. So again, it sucks that it took something like this to change me, but now I am on a mission. I am on a crusade to share with people that you can overcome anything. You can overcome anything. Part of my treatment was, yes, the immunotherapy, the chemotherapy, the surgery, but I also took organic lemon zest in ozone-infused water every day. I cut out the dairy, I cut out the red meat, and I exercised. And one other piece that I forgot to mention in there too is full extract cannabis oil. I did take full extract cannabis oil as well. So I had a plethora of a treatment that I took. And I'm not saying that this is the best for somebody else, but that it worked for me. Yeah.
Right. So what all were the treatments that you undertook? The surgery, the chemotherapy, immunotherapy, and the clinical trial drug. Those 4 are the ones that you undertook.
Yes. So while I was preparing for the clinical trial, I cut out red meat completely. I cut out all dairy completely. And then I also did some research on organic lemon zest. And what you would do is you would freeze lemons, and then every morning, I would zest a lemon, get organic frozen lemon, and I would add that to 40 ounces of ozone infused water. So there is, because cancer doesn't like oxygen. At least that's what I've read. I'm not a doctor, but when you read enough, you understand that cancer feeds off of sugar, cancer feeds off of oxygen, or doesn't like oxygen. So there are devices out there called ozone infusers that adds an extra oxygen molecule to water. And then I drank that with the lemon infused, the lemon zest every morning, 40 ounces of it. and I worked out. I became a fitness nut. So I did all those things, plus put out my positivity, my motivational videos on LinkedIn daily while I was preparing for the immunotherapy treatment. And during that time, there was a person on LinkedIn that saw my motivational videos and said, "Hey, listen, I want you to add something else to your treatment, which is full extract cannabis oil. I will give it to you for free, and I want you to just take that as well." And when you are confronted with the three words, "You have cancer," you will do anything that you possibly can. So I took that as well. So those were the few things that I did prior to the immunotherapy, the surgery, and the chemotherapy. So did that answer your question?
Yeah, it did. And did you also try yoga, meditation, or something like that?
So yes, and I should have mentioned that as well too. So my wife is a personal trainer, and so she helped me with the fitness side of it. But to become one with yourself and to understand that while there is a universal consciousness of everybody is a part of one thing, everybody has their own individual, is an individual as a component of that universal consciousness. So for me, it was every morning doing 5 to 10 minutes of meditation / yoga before I did my fitness workout. And then afterwards we would do a stretching. So it was 5 to 10 minutes, meditation, yoga, depending on how we felt that day. We did it together. My wife and I did it together because, again, having that bond with somebody to share that with you is a motivator for you to not give up and not just throw in the towel, to have somebody else there next to you telling you that this will help you in the long run. So yes, part of my oneness journey was meditation and yoga as well. Yeah.
And on those days that you felt like giving up, what kept you motivated?
I'll be honest with you, is my kids, my children, who at that time were in their 20s, teenagers and 20s. I guess I told myself that I still needed to be a part of their lives. I wasn't finished. I wasn't done helping them be an asset to society. And then beyond that, I wasn't done. I said to myself, if I beat this, I am there's a reason why I'm beating this. There's a reason why I'm sharing my journey with people that I don't know. And why is that? Why is that I wanted to share that? And the reason was, again, it just goes back to the simple fact that once you are confronted with those three words, you either fight or you flight. And those days when I was wanting to fly and move away, I just said to myself that I'm a part of something bigger. I am a part of something bigger than myself. And that if I give up, all those people out there that are watching me, it's not going to be good for them either. So it just felt better for me that when those little glimpses of, you're not going to be able to beat this would creep into my head, I would just squash them right away and just say, yes, I am going to be able to beat this because I'm here for a reason. And that is to communicate with other people that they can do this as well. And that drives me to continue my plight. Does that make sense?
Yeah, it surely does. And what helped you maintain your emotional and mental well-being during that period?
So the universal term sharing is caring, right? I talked a little bit about LinkedIn was my social media platform of choice. And even though it's a professional network, it's the place that I felt comfortable sharing my 2-minute videos on a daily basis, because when I did that, I had people comment back to me and say, Glenn, thank you so much. You made me get out of the bed this morning. Your positive attitude and your positivity, your good vibrations that you put off have helped me get through my day. And when I read that, that again reinforced the notion that I can make a difference in somebody else's life. And so emotionally, that I just kept telling myself, like, okay, I'm not helping just one person. I'm not just helping my family. I'm not just helping my wife. I'm not just helping people that I know. But by me sharing my journey, I'm helping thousands, if not millions of people, because every person, I always tell myself this, is every person that you affect in a day, that then transposes itself to just multiple people, because then that person is happy, that person says good morning to another person, and then that it's a pay it forward kind of circular motion that just keeps going and going and going and going and going. So that's what kind of helped me get through emotionally. Now, don't get me wrong, there were times when I would just completely break down, and as you've seen already, I was never a very emotional person, but now I can cry at the drop of a hat, just like that. I can just turn on the tears, and it's genuine. It comes from the heart. So one other little piece I will say that I haven't mentioned yet is during the chemotherapy part, which is the lowest part of, if anybody's gone through this, chemotherapy is absolutely the worst part of the treatment. In my case, it was anyways. But during the worst part of it, I took my family to Washington, D.C. I went to an exhibit, the Modern Art Museum, and I participated in an exhibit called Pulse. And this exhibit, you walked up to a tablet, you put your hand on a screen, and there were EKG sensors in that screen that picked up your heartbeat and then mechanically transposed them into water. So you visibly saw ripples of water moving to your heartbeat. And at that moment, I had what I call an epiphany or an aha moment. And at that time, full disclosure, I was growing medical cannabis as part of my treatment. And when you grow things, and you make them healthy, it makes you feel better as well. So at that moment, I had an epiphany, and I said to myself, I wonder if I could take my heartbeat and I could mechanically vibrate or mechanically stimulate plant growth using my heartbeat to customize my medicine that I'm using to my body. And I did that, and I made a device that works just for that purpose. And so I've been developing that over the last 3 years. And so that has been another purpose of mine, is to share that that good vibrations that people always talk about. Good vibrations are not only felt by people, but they're felt by the planet and other animals and plants. And without vibration, we wouldn't be here. Everything vibrates, everything moves at the cellular level. So by me continuing to put out good vibrations, it helps me be a better person, and therefore I'm here talking to you all, and you all are going to get a piece of me. And I hope that it helps you be stronger and be the person that you want to be.
And what would be your message to other cancer patients and their caregivers?
Yeah, so for cancer patients, everybody is different. Everybody is an individual, and everybody has their own resonance, their own frequency inside of them. You need to find which one works for you, which one resonates for you. There is not a catch-all that says this treatment is going to fix every type of this cancer, because no person is exactly the same. So what I tell cancer patients that ask me this is, find it yourself and use your tools that you have out there, like listening to me, take a piece of what I've given, take a piece of what other ZenOnco people are saying, take pieces of that and make your own treatment, because everybody is an individual. There is no catch-all. Even though we're all one piece in the grand scheme of things, everybody has their own little piece. And so just don't give up and continue to try and find pieces of other people's journey that you can then use for your own. So that's what I would say to cancer patients. Don't give up, get your second opinions, use all the pieces and all the tools that are given to you to make your treatment work for you. And then as opposed to, for cancer caregivers, the biggest thing that I can tell the cancer caregivers is, while if a cancer patient is in remission or has been cured, and I will say that I always love that modern medicine says, if you make it 5 years, you're cured. I don't want to hear that, because guess what? Then that means that I've got 1 year left. Really, you know, like in their eyes, if I make it 1 more year, I'm cured. That's not the way it works. That's not the way it works, because if a cancer patient is cancer-free or has no evidence of disease, NED, guess what they still have? They still have scanxiety. And scanxiety means that in the back of your head, every year that you go back for this scan, they could tell you that it has come back. So from a cancer caregiver perspective, you may look at them and say, they are cured, they're great, they're excellent. They've beaten cancer. You're good. You don't need to ever think about that other. That's wrong. That is wrong. You are forever changed when you hear those 3 words. So from a cancer caregiver perspective, you need to remember that in your head and not continuously tell them, you look great. You can tell them those things, but you have to understand that the cancer patient, the cancer survivor, the cancer warrior still has that thing in the back of their head that will never leave them. That will never leave them. It's always there. It's always there telling them, hey, you know what? You've had it once. You have a better chance of getting it again. And if it comes back again, it's not, let's treat it. It's let's talk about end of life kind of crap. So caregivers, just remember that a cancer patient is always forever changed. So that's my message.
And finally, if you would have to sum up your entire journey in just one sentence, what would that be?
Every day that you wake up is an opportunity to change someone's life. Do it.
It was really, truly inspiring talking to you, Glenn. Thank you very much for sharing your journey with us and with all our viewers as well. Wish you all the very best for all your future endeavors, and thank you very much.
Thank you. Thanks for having me on. I appreciate it. Yep.
Bye-bye.